Good evening and welcome to a very special show, BP Right Karo. This program is supported by IHW Council and is a public awareness campaign by JB Chemicals and Pharmaceuticals Ltd. Every year, 17th May is observed as World Hypertension Day to raise awareness and promote hypertension prevention, detection, and control. Hypertension or high blood pressure is a common condition which usually goes unreported as there are no symptoms. Over the long term, uncontrolled hypertension increases one's risk of serious health problems, including heart attack and stroke. It has been long recognized as one of the major risk factors for chronic disease burden, morbidity, and mortality in India, contributing to about 10.8% of all deaths in our country. 1 in 4 adults has hypertension in India, and 1 in 10 has it under control. While hypertension is treated with drugs or a combination of them, monitoring BP at home is a very important step to keep it under control. Precise and reliable blood pressure measurement is essential for appropriate diagnosis and management of hypertension. Many people have a home BP monitoring device since they're affordable and accessible. But just having a machine at home doesn't mean that you're in all clear. One has to know how to measure BP at home accurately to keep the disease under control. JB Chemicals and Pharmaceuticals has initiated an awareness program to spread more information and educate people on the right steps and procedures to follow while measuring blood pressure at home. BP Right Karo is a series of instructions in both audio and visual format to help and guide as many patients as possible across the country in measuring their home BP correctly. Here's a video for you to find out. We'll play this video again for you on the show so that you become clear on how to measure one's BP at home. But to understand the facets of hypertension and how to keep a check of one's BP at home, we are delighted to welcome Dr. H.K. Chopra, Senior Consultant Cardiologist, Medanta Moolchand Heart Institute, New Delhi. He's a senior cardiologist, and Dr. Chopra is an award-winning author of textbooks on cardiology. He has been the past national president of Cardiology Society of India and is the current president of the World Wellness Foundation and World Heart Academy. Thank you so much, Dr. Chopra, for joining us on this show. We're very happy to have you with us.
Thank you.
So there are a lot of lifestyle diseases that the common people have to now deal with. So when it comes to hypertension and diabetes, what is the Indian scenario like? Is there an increasing trend in these lifestyle diseases like hypertension?
Thank you, Anisha. At the outset, I really wish to compliment IHW Council and JB Chemicals Pharmaceuticals Ltd to give me this important and most prestigious platform on enhancing hypertension awareness, which is the need of the hour. I firmly believe that uncontrolled hypertension is like a global tsunami. It is silent killer, you already mentioned, but it's a global tsunami because hypertension inflicted heart attacks, brain attacks, leg attacks, eye attacks, and nose attacks are very common. You mentioned what are the important factors in the lifestyle. I think everyone should know that to a very large extent, hypertension is self-inflicted by our faulty lifestyle. In a way, to remember in a very simple way, we should remember 10 S. Number 1 is salt, excess of salt consumption. Number 2 is saturated fat. Anybody who is consuming saturated fat is more liable to become hypertensive in a young age. Number 3 is sugar. Excess of sugar in any form may be responsible for a hypertension. And sedentary lifestyle, then stress, smoking, these are 6S. And 7S is very important when there is inadequacy of sleep. We need to have 6 to 8 hours rest. And then 8th is snoring. Sleep obstructive apnea, very, very common, a very, very common cause of hypertension. And then come the last 2, which are very important, is superfluous use of alcohol. What we call as excessive alcohol intake is also responsible for excessive fluctuation of the high blood pressure. And the last one, which is not uncommon in women, is like stubborn attitude in obesity. They don't stop. There are some psychological factors responsible for the morbid obesity. So these are the 10 important factors in lifestyle which gives rise to a hypertension at a very young age. So every system in our body, like activation of so-called sympathetic nervous system or RAS system or NPS system, which are responsible for a hypertension, get activated by faulty lifestyle. So I feel optimization of lifestyle right from the childhood is important if you want to be normotensive at least till the age of 80. After 80, it is God's will.
Dr. Chopra, you in the beginning of your answer mentioned the different kind of attacks that are happening because of hypertension. I'm sorry, but I was only aware of heart-related problems that come up because of hypertension. Because uncontrolled hypertension puts too much pressure on your arteries, etc., and then organ damage starts happening. What are the other attacks that are possible because of hypertension?
See, uncontrolled hypertension is a very, very important cause for a heart attack, unstable angina, or a stable angina, so far as heart is concerned. It can also cause a brain attack, what we call as TIA or stroke. And then it is also responsible for a leg attack, means the whole aorta, the major artery which originates from the aorta, may get dissected because of the very unaccustomed hypertension which he is used to. And then there is a nose attack. A lot of people, they come to us with the bleeding from the nose because of a very high blood pressure. The arterioles, they rupture and patient will start bleeding. It's one of the compensatory mechanisms, like a safety valve which is opened up. Similarly, I see a lot of patients who come to me with one eye completely blind. And if I check your blood pressure, it is 200 by 120 or 130. There is a bleeding hemorrhage in the eye. So these are the various reasons why patients come to us. Sometimes they may get a kidney attack. They are not aware of. They come with an acute kidney injury, or they may get so-called CKD or a chronic kidney injury, all because of it silently happening without giving any information, and patient walk to us in the hospital in a very advanced stage of a catastrophic situation, which is inflicted by uncontrolled hypertension. The awareness of hypertension is very, very low in India. 42% of hypertensive patients don't know that they are hypertensive. They are not aware. But when we go and put on a camp or something like that, we come to know they are hypertensive and not taking any medication. And I was surprised to see the data of Ministry of Health, ICMR and WHO. In India, the control rate of hypertension meticulously is only 10%, which is very, very painful. 35 to 40% of individuals at a young age are becoming hypertensive and young age. And it's very simple to remember, at the age of 50, 50% are hypertensive. At the age of 60, 60% are hypertensive. At the age of 70, 70% are hypertensive. And at the age of 80, 90% are hypertensive. Mahatma Gandhi died at the age of 79. He was hypertensive when he was only 60, but he controlled his blood pressure well by optimizing his lifestyle. He used to walk a lot. There were no medication those days. And I remember his words, which he wrote in a book, Salt Consumption, Pure Vegetarian. And he always said, our health is not in piles of notes. Our health is not in gold. Our health is not in silver coin. Our health is in our choices. So if we have perfect choices and perfect mindset, we are going to be a healthy person with normal tension. And if we have a normal tension, we grow younger and live longer.
Right. What you've highlighted for us is quite, the situation seems quite grave. You are suggesting that nearly half of the younger people affected by hypertension would not even know that they have it. Now, the NFHS 5 data mentions that diagnosis and control of hypertension in India is very poor. It could be the lack of awareness, whatever be the reason. The initial diagnosis of hypertension doesn't happen early, and hence, by the time the patient is diagnosed, he's already into stage 2. There could have already been some sort of organ damage. How do you see this? And how can we improve diagnosis? Because this doesn't have any symptoms. There are no clear symptoms. So how does one catch it early?
I think it's a very good question, Anisha. Hypertension has to be detected when it does not produce any symptoms. By the time
Recording in progress.
By the time symptoms come, that means patient has had hypertension for a long time. And the symptoms are very atypical, like they may have heaviness in head, an unusual headache, they may even have dizziness, undue fatigue, sometimes even breathlessness, or undue discomfort in the chest. There are vague symptoms which are not specific to say that he or she is hypertensive. The unfortunate part is we did a study from the Society of Cardiology somewhere in 2017. We published in Indian Heart Journal, and we've shown in almost 1 lakh patients, which we studied in one day in 8 hours, that 42% of patients who were hypertensive were not aware that they have hypertension and the blood pressure was not controlled. So awareness rate, we must launch mission hypertension care. Digital is the only way, like we're having today. We must act vocally, focally, locally, and impact globally. Digital method is the only way to reach to masses in the rural areas, semi-rural areas, urban areas, and everywhere in the world. Not once we are doing it on the occasion of World Heart Day. According to me, Hypertension Day should be every day. Why only once a year?
Dr. Malhotra, why is it being diagnosed late? Because why I'm asking in this, whenever I step in to see a doctor, usually at a hospital, the standard practice is to take your weight, your height, and your BP. Even if I'm going with a fever or any other kind of symptom, this is usually the practice. Height, weight, BP is taken. So when you're measuring BP, when you're going to the doctor, why are you not diagnosing it early enough?
See, it's very simple. As I mentioned to you, we must start this initiative in the schools. The children, when they don't have any problem. So if we examine, say, 1,000 children, we will see a lot of them are hypertensive and they are not aware of. Early checkup, early diagnosis, more awareness, and a regular campaign. It has to be a regular practice of examining blood pressure on daily basis. According to me,
are you saying the one-off, I met the doctor, my BP was fine, is not good enough?
No, not at all. Not at all. The reason is it's a dynamic process. Blood pressure is not a fixed attitude. Today I can be a normotensive. After 1 hour, if Anisha loses temper on me, I'll become hypertensive. Just one fit of anger can produce hypertension to both of us. We get a lot of patients coming to us as a chairman or CMD of an organization. They are not able to meet the deadlines of something or the other, and they have a loose fit of anger. One fit of anger, I get people from Supreme Court, all judges and this thing, because it is the discharge of negative emotions which are responsible for a paroxysmal episode of hypertension. So you should know what is your baseline attitude of life. Are you a stressed personality, type A personality, or you are a calm and cool personality? And everybody has to be taught that you have to be very calm and cool, and you should not be aggressive, you should not be hostile, you should not be irritable, you should not be revengeful. Vengeance, frustration, suppression, repression, depression are the common causes in the stress related hypertension. These should be taken care of. We need to have a balance of mind, balance of eating, balance in sleeping. If all this balance of life is there, then we will never become hypertensive, at least till the age of 80. After 80, our biochemistry is definitely going to change. Anisha, I must tell you today that we have 60,000 miles of blood vessels in our body, and there are 6 billion capillaries with 60 trillion cells and 6 trillion chemical reactions occurring with 60 neuropeptides right now in you and me. But we are calm, so we are normotensive. If we are little abnormal in our lifestyle, we'll become hypertensive. So it is a moment-to-moment check. Our blood pressure vary from daytime to nighttime is different. After every hour is different. Every 1 minute, every 2 minutes it changes. So blood pressure checkup after 20 is a must. And after 80, everybody should check his or her home BP monitor at home, which is very, very important in a digital method. We don't need a stethoscope. It's just a digital method. You just demonstrated, Anisha. That's the best way of measuring the blood pressure, because the clinical blood pressure may give you a false reading because there is a white coat hypertension effect. Stress is there, and rarely a patient may need a ambulatory blood pressure monitoring, because when there is a significant fluctuation of blood pressure, especially in the season, like in winter season, the tendency of hypertension is high. In summer, the tendency is low due to various neurohormonal biochemical mechanisms. The blood pressure become high in winter season.
So, Dr. Chopra, what you're saying is that any emotional stress could become a trigger for high blood pressure. So, isn't it a good idea to then just monitor your blood pressure regularly at home? Now, most doctors and guidelines now are stressing on the importance of home BP monitoring for accurate and consistent BP reading. So, what is the importance then, and who should start monitoring the BP regularly? Because stress as a way of life has become a way of life. You're talking about students. Students also are stressed because of exam pressure. Executives, housewives, everybody has some pressure. So, should monitoring BP at home become standard, and how important is it doing it the right way?
If there is no stress, there is no life. The only thing is how to cope with the stress is important. If there is a positive stress, we call it the eustress. If it becomes negative, we call this a distress. If you see a red light is a discipline. If you just settle down for some time, you'll be in eustress. But if you cross the red light, then becomes a distress. So this is a simple example for you. So I think if you're balanced, you reach half an hour earlier, you'll reach in time, there won't be any stress. But if you reach half an hour late, then you are bound to be stressed. So I think how you balance yourself and how you manage your time and how you manage your life, that is the whole game. So stress is necessary. Without stress, there is no life. But one should learn how to cope with the stress, and moderation is the key, which is very important. And I am checking my blood pressure every day in the morning. As I get up, I check my blood pressure every day for last 30 years. And
okay,
that's
is that a good time to monitor? Because
early morning is the best time, because that is the time known as circadian rhythm. Our circadian rhythm, all the hormones are liberated maximum in the morning hours. That's how highest number of hypertensive accidents are seen early morning. Heart attacks are seen early morning. Strokes are seen early morning. And early morning surge is seen early morning, because they may cause all kind of events morning hours. So if you check your blood pressure 6 o'clock, or 5 o'clock or 6:30 or 7 o'clock in the morning, please make sure your time is fixed and you check your blood pressure every day. You
At the
should be
same
in a
time.
calm, yeah, same time. And you should be in a calm mode. You
Mhm.
should not be stressed. Don't start shouting at your spouse, which is very, very common in the morning hours. If children has to go to school or somebody has to go to school, you are in a hurry, you want to do all three things all together. So I think we should be in a very calm mode. We have to make sure that we keep sitting position and we keep our arm in a proper position and blood pressure instrument at the level of the arm. And most important thing is none of us should do any exercise before any blood pressure. Nobody should take excess of coffee or tea before taking the blood pressure, and nobody should smoke. Like a lot of smokers are very fond of smoking, having early first cigarette early morning. That's not right. And one can take a blood pressure, and blood pressure should be recorded. Both systolic is the upper one and the diastolic is the lower one. Both the blood pressures are very important. If you see American Heart Association or European Society of Cardiology or Society of Cardiology in India, all of them recommend that our blood pressure should be 130 by 80. So there is no controversy or ambiguity so far as the number is concerned. 130 by 80 is the ideal blood pressure. That should be our target. Any blood pressure which is more than 130, it's labeled as elevated hypertension. And if it is more than 140 upper one and more than 85 or 90 lower one, we call it a stage 1. And when it is beyond that, we call it a stage 2. And third is complicated hypertension. And all hypertension affects the brain, the eyes, the kidney, and every system of our body. And so many billions of capillaries, as I mentioned to you, are also affected by the blood pressure. Blood pressure is a pressure generated by the blood during contraction of the heart. So this is what exactly happens. And we must ensure that home BP monitoring should be done by everybody at least after the age of 40.
All right. Dr. Chopra, you mentioned 130/80. These are the normal BP levels, right? And what amount of variance would be considered okay, acceptable? And do these normal values of BP differ in gender or people who have serious disease, already have serious diseases or comorbidities?
It's a very good question. If a person is normal, the blood pressure 130 is accepted worldwide. But if a person has got comorbidities, like if he's got a kidney problem, if he has a heart problem, he has a stroke problem, he has a asthma, bronchitis, or any other problem, then there is a little grace. We always give it to blood pressure on the little higher side as compared to a normal person. For example, if a person has got CKD or got a little stroke, but still our objective is to keep the blood pressure as low as 130 by 80. That is the target we achieve by enhancing the dose of blood pressure medicines or lifestyle optimization. So the target we still feel ideally for everybody should be 130 by 80. But as we advance in our age, say after 70 or 80, we have tendency for the high blood pressure. But our target should be systolic should be 130, not beyond 140, and the diastolic should not go beyond 90 at all. So my personal belief that 130 by 80 is the ideal blood pressure without any confusion. And for comorbidity, please consult your doctor. Don't manage yourself. It will create detrimental effect on you.
Right. Dr. Chopra, the blood pressure monitoring machines will themselves record the upper and the lower levels, right? There is nothing that the patient has to do on their own, right? It automatically comes, right?
Everything is digitized. You just have to put on a cuff of proper cuff size and make sure that you remove your shirt sleeves. Don't take it on the sleeves. Don't take it on a sweater or on a jacket. Then you may get an error in the reading. It should be right on the skin and take your blood pressure. Some machines are tuned to record 2 or 3 times. They give you mean of 3 readings, or some machine give you directly in a digitized manner, and that's usually an accurate blood pressure. It is used worldwide. There are automated machines. They use that also. There are mercurial machines. There are Android machines. We should not bother. Digital is best for a common man.
Dr. Chopra, these days, you have a lot of these wearable devices, especially smart bands and smart watches that claim to be able to measure your heart rate, your oxygen saturation, etc. But are they accurate? Can these be depended upon?
Anisha, you asked a very good question. I remember when I used to go to railway station, I used to check my weight by weighing machine. And I still remember that I used to pay some 10 paisa coin or 50 paisa coin. The same way I feel we should have a kiosk. This kiosk should be on the airport, on the railway station, on the marketing places, in schools, colleges. Everybody goes and put the arm and check the blood pressure. You asked me a good question. How about those bracelets or something people put on, the watches? I don't believe those. The reason is they make you more like a psychopath. All the time you're concentrating there only. You work and again you see my blood pressure has gone up. It's not required. It is only required in those situations where there is a significant fluctuation of blood pressure. If your blood pressure is normal, you don't need it. People go to United States or UK and buy, or because their son or a grandson or somebody is there, is sending them and you're putting on. I don't think it is right. And even I've seen the data, the error is much more. So we need to standardize those and we should not make person a psychopath. I think whenever there is, if you do once a day, that's more than enough. You can't keep it constantly on a watch and keep on saying what is my pulse, what is my blood pressure. And it makes you psychologically aware and it may cause a lot of negative impact on health. So I don't recommend it to any of my patients. I just say home BP monitoring is the best. I do myself home BP monitoring. I never put on those new gadgets on the wrist. It troubles me. I want to keep my wrist free. I'm not comfortable with a wristwatch. What to talk of the other other gadget on the wrist. So I will recommend.
So Dr. Chopra, could you then tell us the foolproof way of measuring BP correctly at home? What are the good home BP measurement practices and things that people should avoid doing? You said don't put it on a cloth. Any other things, do's and don'ts?
The other thing, that the room temperature environment should be good. The room temperature should not be very hot. It should not be very cold. It should not be very humid. Environment should be good. And of course, as I mentioned to you, our relationship with the spouse should be very good. If you have children or grandchildren, or relationship with them should be good. Not we are not irritated mood in the morning and checking your blood pressure. You have no time. You have to go and drop your children to the bus stand, and then you're checking your blood pressure. It is bound to be high. Or if you're preparing a tiffin for your children, your BP is going to be high. So you should get up at 5 o'clock before all those things. Because most of the times I've seen the children's exams, but the mothers are also in the exams. They're also much more stressed than the children. So I think how best you can see that you have free time and relaxed time. That is how you should check your blood pressure without any stress on your mind. And you should not do anything like taking 2 cups of tea or 2 cups of coffee or smoking a cigarette and then checking your blood pressure, which is give you erroneous results.
All right. We're coming towards the close of the show, Dr. Chopra, and there are many, many people watching us. What would you like to tell people about hypertension, and what you've told us that stress has to be managed, stress cannot be eliminated. How can one have a good lifestyle? What are the lifestyle tips that you'd like to give to people?
I think it's a very good question, Anisha. In my opinion, you and me are expression and manifestation of optimization of our choices. Our health is an expression of our own perceptions, our own thoughts, our own interpretations, and our own choices. If our choices are perfect and our mindset is perfect, we are going to be healthy and non-retentive. Most of us are busy in earning money and becoming hypertensive. And then we are busy in losing that money and trying to earn health, it is gone. I think this fundamental has to be understood. That's what Mahatma Gandhi told. The health is not in the piles of notes or in the gold, piles of golds, or it is in silver. It is in your choices. If our choices are perfect from the right, then we are not going to be hypertensive. Second thing, if we are all the time thinking of a quantity of life and not the quality of life, you are going to be hypertensive. So if you have good quality, then we'll grow younger and remain longer with normotension. I also say, oh, what we eat definitely matters, but what is eating us matters more. Longer is the waistline, shorter is the lifeline and a heart line, and you become more hypertensive. No obesity, please, no pot belly. Always smile. Again, Mahatma Gandhi, I quote, he said, you are not dressed completely if you don't have a smile on your face. You might have an artificial smile, but one should do it, as Anisha is doing it. So smiling is the best gesture by which we control our blood pressure, because there is a liberation of so many natural opiates which keeps our blood pressure normal. We should never be angry unnecessarily. That is not the unjustified anger. We should sleep 6 to 8 hours every day. Don't get hooked to video and don't go hooked to TV or to mobile phone, what we call as WhatsApp. They strain the eyes and they make you more hypertensive. Noise pollution, air pollution are very, very important predisposing factor for becoming a hypertensive. So if you live like a human being in a very calm environment, then we will definitely be very healthy and we'll have a normotension. But if we are not following the law of nature, eating at the wrong time, in a wrong manner, in a wrong dose, in a wrong environment, we are bound to become hypertensive. Not smoking. Nobody should smoke. Nobody should chew tobacco because we know it is harmful. In the olden days, people used to get motivated by all those advertisement campaigns, Sache Log, Sacha Anand. But we should not be motivated by all those campaigns. I personally feel that we in India should launch Mission Hypertension Care. And we make sure in every school, there should in the curriculum, there should be hypertension awareness knowledge. So that everybody knows what the blood pressure is all about. In every school, there should be kiosk and digital method is the only way. And every NGO, every organization like Scope, SHM, PG Chamber of Commerce, everybody should volunteer. Rotary, Inner Wheel, and your organization like IHW Council is a very good council who is integrating the modern science and the ancient wisdom to enhance awareness on health, because we are known in the world as the world capital of hypertension, heart attacks, strokes, diabetes, dyslipidemia, obesity, and whatnot. A time has come, we need to have paradigm shift from illness to wellness. So our country should be considered as a world capital of wellness. And that is what the theme of our Prime Minister is. So we must inform, perform, reform, and transform the whole world with normotension from your platform.
Right. Dr. Chopra, while it's a good idea for those over 40 to monitor their BP regularly every morning after waking up, before consuming any tea or before exercising, would you have any diet tips? Because you said excess sugar, excess salt, they all lead to hypertension. But our diets are such, they are full of salt and sugar. All these processed foods are full of salt and sugar. And while you said we need to manage stress, a lot of people are now turning to yoga, meditation to manage stress. Is this the way out? I wanted a few tips from you in diet and exercise.
It's a good point. I think yoga, all the 8 limbs of yoga should be followed. When I say all the 8 limbs, means yama, niyama, asana, pranayam, pratyahara, dharana, dhyana, and samadhi. I spoke fast. A lot of people have not understood what I mean. Yama means do's and don'ts. That's the first limb. Niyama means self-discipline. Asana means postures, various postures which are all taught in the sun salutation and all that. Pranayama is a breathing exercises. Then contemplation, dharana, samadhi, and then we go to the lastly is a meditation. If you follow all the 8 limbs of yoga, everything comes there. Do's and don'ts, what we should not eat and what we should eat. We eat fast food. I remember so many people come here from outside and they stay and they take their breakfast, lunch, and dinner in some fast food restaurant. And within 2 months, they gain weight and they have hypercholesterol, hypertension, and diabetes. So it's very obvious diet plays a very important role. Sattvic food. We should take more of vegetables, more of nuts, and more of water. Hydration is very, very important. And avoid junk food or fast food. They are not good. So far as the non-vegetarian is concerned, one should take fish sometimes or chicken, but no red meat at all. So I think we are very fond of eating pakoda, samosas, halwa, mithai, all those things. Occasionally is fine, but not every day. If we eat samosa all the time, our mind will also become samosa. So that's a very important thing one should know. So we should take sattvic food, then we'll become a sattvic mind and not a tamasic mind or an agitated mind. So if we eat a nice food and a nice time in a very disciplined manner, we are going to be healthy. I personally feel one should meditate every day. I do every day. I'm now for last 30 years a meditator morning and evening for 20 minutes each time. And I go to Lodi Garden almost for 30 minutes every day. And I work for almost 15 to 16 hours every day. So I try my best to be as disciplined. I don't smoke, I don't drink, and I'm pure vegetarian. So I follow what I'm preaching, and I follow everybody world should follow, every family should follow. Then life will become very, very smooth and we will not have any problem. In India, unfortunately, our habits are wrong right from the childhood. So our parents, when they go to work, they are busy, they give their children potato chips. Beta ye kha lena school mein. Very, very wrong. They should give a fruit to them. Children don't know what their parents are feeding them. So I think if you nurture the idea of a good diet and a healthy diet and a practice of yoga every day and meditation every day and exercise, they should walk every day. Walking, jogging, swimming, dancing, cycling, treadmilling are the best heart-friendly exercises. Heart-unfriendly exercises should not be done, like weightlifting or push-ups. They increase the isometric contraction and cause increased tendency for hypertension. So I always say, use it or lose it. In other words, what I'm saying is use your body if you don't want to lose it. But if you're sitting all the time, a sedentary habit, you're bound to have this. Cycling is very important. One should walk. Walking is the best way to control of the hypertension. As I mentioned, the example of Mahatma Gandhi, he was a person who used to walk highest whole circle of the earth. He has completed in his whole lifestyle. So that is the kind of walking one should have. And it should not be maybe brisk walk, what we call is walking and not jogging. And of course, it should be done under the supervision of a doctor and avoid exercise in an unaccustomed manner, in a too much of heat or too much of cold should always be kept in mind, should be in a good environment. Preferably in a nice green garden. People do treadmill at home and they forget of going to green garden. No. We must have a fresh air and have a nice yoga there and do it on a regular basis, not 5 days a week. I believe every day, because we eat food every day. The same way we should exercise also every day. If we exercise every day, eat the right food, we are not going to fall victim to hypertension. If at all we fall victim to the hypertension, please consult your doctor for proper medication in time before it's too late.
Right. Thank you so much, Dr. Chopra, for joining us and sharing with us your wisdom. We really need to create awareness about hypertension, how to monitor it, and how we can even lifestyle to try to reduce the risk of getting hypertension. Thank you so much for joining us.
Thank you, Anisha. Thank you very much.
We'll wrap up this special show here. I'm pretty sure this has been an eye-opener for hypertension and how to monitor it at home yourself. Do follow us on Facebook to get all the updates on our upcoming shows. Till we meet again, stay safe, stay healthy, and take care. Goodbye and see you soon.
Thank you.